Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hello, I'm Dr. Warren, and today we're going to talk about post-treatment Lyme disease syndrome. Now, this is the new name for chronic Lyme, and when the CDC acknowledged that Lyme can cause chronic long-term problems, there was a big argument over the name. Now, this is a question that I get somewhat frequently, and I've avoided talking about it because I think it's a little complex, but I'll do my best to try and decipher why they want to call it post-treatment Lyme disease syndrome. I'll go through why I think it's a big mistake, and really what we're arguing about when we're arguing about the name is what we really think is causing the problem, and that's why this debate is so fierce. Now, on a practical level, whether we call it chronic Lyme or post-treatment Lyme, I don't think has a ton of difference to you if you are a sick person right now. But it has a big implication for how do we solve the problem, especially with ongoing further research. And so I'll try to run through a little bit of the history and a little bit of the explanation so you can understand where this fierce kind of behind the scenes secret war is taking place on what is the really root cause of post-treatment Lyme or chronic Lyme. Here we go. So most people know that Lyme disease can cause this acute flu-like illness following a tick bite, and then typically we can get a rash, we can get headaches, fevers, and this is where the standard 2 to 4 week antibiotics work really well, right after you caught it in the acute setting. Now it goes from early stage to a late stage, somewhere between 2 and 6 months, and we're into the chronic stage for sure by 6 months, possibly earlier. Now, while the CDC acknowledged the acute form of Lyme in the early to mid 90s, it wasn't until 2023 that the CDC acknowledged that this chronic Lyme or post-treatment Lyme, whatever we're going to call it, does in fact exist. So you have 30 years of doctors and advocacy groups fighting for this is a real problem, it's a crack in the system, people are suffering from this. And in fact, as late as 2022, we have the CDC on its website saying any form of chronic Lyme was pseudoscience and pseudomedicine. I will include a link to the CDC's new opinion. They just wrote a new update on January 2025, but their first time acknowledging that in public was in 2023, to my knowledge. Now, the big question when we're talking about the difference between acute and chronic or post-treatment Lyme is there is a realization that somewhere between 10 and 20% of people after they get Lyme do not return to their normal health. So they have ongoing health struggles to varying degrees. It usually includes fatigue. Many people have pain. That can be muscle pain, joint pain, headaches, neck aches, because Lyme loves collagen tissue. And then lastly, we get a plethora of neurological effects, anywhere from neuropathies to central nervous system disorders, sleep problems. It can affect any part of the nervous system. Now, once you throw in co-infections, which we don't have time to talk about today, the symptoms can become even more varied once you throw in many of the other things that come with ticks, and the vast majority of people who have chronic problems do not have it alone. They have the Lyme paired with these co-infections. So when we talk about naming it chronic Lyme, the name got officially changed to post-treatment Lyme. Now, for practical purposes, they're kind of the same. It's ongoing symptoms that we just talked about, and you're not getting better, and it's severely affecting your life. That is not the difference. The difference is what's causing it. So in post-treatment Lyme, we're saying you got 2 to 4 weeks of antibiotics. Now, there's this vague, unknown box if you've been sick for a long time with Lyme, but you've never gotten that 2 to 4 week of antibiotics, because you can't really be in the post-treatment group if you've never had treatment. So one of the first things I don't like is we've kind of created this subgroup of people that don't quite fit in this medical box, and medicine does tend to be very, very paralyzed if you can't fit into a nice coded box. So that's my first problem, is we've created this subgroup of people. But let's just go forward with it. So the reason that the big fight to rename it post-treatment Lyme versus chronic Lyme is all about what's causing the ongoing symptoms. Now, for years, Lyme advocacy groups basically said, well, the Lyme is remaining alive. There is chronic forms, there's stationary forms, there are biofilms protecting this Lyme. So you have this low abundance bacteria Lyme, which is still there, still growing, but slower, causing these ongoing symptoms. There is a plethora of evidence showing that that's absolutely true. And the post-treatment Lyme disease is really pushing away from that and ignoring that. Now, this puts me in an awkward position to try to explain this to you, because I have to actually argue kind of for antibiotics, even though I'm not a huge fan of antibiotics. So the big difference is in chronic Lyme, the advocates for chronic Lyme who've been fighting this for 30 years are saying there is still some resistant, persistent, I actually like the word persistent Lyme the best. So some forms of these organisms are persisting, and therefore we do need something that helps to kill them. Now, classically, from a medical point of view, this has just been triple antibiotics, high-dose antibiotics, gobs and gobs of antibiotics. Now, when you are killing Lyme in the chronic phase, I firmly believe that the actual herbal route is better at killing these resistant biofilm stationary forms than this high-dose antibiotic therapy. But you do need something in the program to kill the remaining resistant, persistent bugs. And this is the big fault I see with post-treatment Lyme, is they're saying here's the symptoms, but it's not coming from any kind of living organism left. This is when the CDC updated, and I'll show you a link to their page. What they really did was they said, we acknowledge this exists, but they really took an aggressive stance against high-dose antibiotics. In fact, they added references to this page, and if you go through these references, what you'll see is they are not references about a solution. They are references against long-term antibiotic therapy. They are references against the long-term use of antibiotics and the harm that it might cause. Now, this is where we get into kind of nuance, guys. There is risk of doing high-dose long-term antibiotics, doing multiple antibiotics, doing them for 6 months, 12 months, 2 years. There are some problems that happen if you're going to do that on a massive scale. I agree with that. I believe firmly, based on science and based on my experience, that the herbal route, you can be specific, it's less toxic, and it's better at killing these chronic forms. So I'm not a huge fan of the just nuke it with antibiotic strategy. However, I believe this post-treatment Lyme, which is saying you don't have to do anything to kill it, is absolutely wrong and is going to lead us down into a tragic, catastrophic place. All right, so here's the theory on the post-treatment Lyme. And there is some evidence for this, which I will just make another article and we'll go through this concept, because I don't think it's super well known. There is some evidence that we have fragments of Borrelia burgdorferi proteins that are very difficult for the immune system to clean up. So under normal circumstances, when you get a bacterial infection, your body will destroy the bug, and in a very short period of time will be able to clean out the dead fragments of that bug. So think about after a war scene in a movie, there are kind of dead bodies everywhere. It's just a mess. There is a process of kind of cleaning that up. It's a gross job. Somebody's got to do it. In the body, this is really macrophages and the lymph system that's really supposed to be clearing these out. And there's some new emerging evidence that basically these proteins are definitely harder to clear out than normal. There is some modification that the bacteria is getting literally from the tick. So there's some modified proteins from the bacteria interacting with tick proteins that seem to be a reason why this particular bacteria is harder for your immune system to clean up than normal. Okay, so here's the skinny on the post-treatment Lyme disease. It's saying, well, the bug's dead, but there's these remnant proteins the immune system continues to react to. Now, I know what you're saying. Okay, well, if there's these remnant proteins that the immune system reacts to, can we help the body clear those proteins out properly? That would be my question. these things I believe are both happening. So I believe both, you have to kill it and you have to help the immune system. This is why we do a threefold approach for Lyme. We want something that kills the bug. We want something that helps balance the immune system, which is struggling to do its job. And we want something to repair the broken parts of your body. So this is why we need to repair collagen and connective tissue. We need to help the nervous system, whatever part of your body is taking the brunt of the attack. Okay, but this is our threefold approach. Now, in the post-treatment Lyme, they're moving away from the kill phase. They want to do no killing. They want to have no part of killing, which I believe is very unscientific. Now, this is hard because I would say the big thing I have in the chronic Lyme community is an overemphasis on killing, and then not as much emphasis on the immune system component. Now, in post-treatment Lyme, what I think is going to happen as this goes is they're actually going to totally underemphasize the killing part of chronic Lyme, which will be a catastrophe. And instead of helping the immune system to clear up the remnant proteins, fragments from the Lyme, they are going to try to just block the immune system from creating inflammation with the proteins there. So this is, to me, they're trying to develop, you have a marching band in your living room and we're just trying to make the best earplug possible so you don't hear it. And this is a place in research that I think we're just going to go down the wrong road. So on one hand, I spend a lot of my career talking to people about how chronic Lyme exists. I think that's now been established. I'm so thankful for that. When they renamed it post-treatment Lyme disease, there's a push towards wanting to use more immune suppressing drugs on patients. And in my experience, doing a variety of immune suppressing drugs on patients gives you some short-term relief because the inflammation comes down and it makes people worse in the long run. I think it's actually going to be harder in the future for me to help people who have Lyme disease. So what I'm very, very afraid of with the shift to post-treatment Lyme disease is I will have more and more patients on heavier and heavier immune suppressing drugs, which are practically speaking my most difficult cases. Because when you have Lyme and these co-infections still in you causing problems, doing immune suppressing therapies, you have to be very careful, especially anything more than short term. Any long-term immune suppressing therapy really leads us down a dangerous road where the bug grows more because you're inhibiting your body's fight against it. And I think this is leading us down a wrong road. This is my first video on chronic Lyme versus post-treatment Lyme. From a symptom standpoint, interview, they are the exact same. You get Lyme disease, you don't get better. We think that happens 10 to 20% of the time. We end up with pain, fatigue, or odd neurological symptoms. And from a practical point of view, we strongly believe the best way to do it is that threefold approach. We need something that kills the bugs. I strongly think herbs do a better job once it's chronic than a lot of the antibiotics, but you need some therapy that goes and attacks these chronic bugs, Lyme and co-infections. We need to help the immune system, and this is where the PTLDS is onto something that I think has been underemphasized. The immune system is a part of the problem because it's fighting these bugs and it's failing, but we need to help the immune system function properly rather than suppress it. I can't emphasize this enough. And then lastly, we want to repair the body, the parts that get broken. I believe this is the best approach for post-treatment Lyme disease or chronic Lyme. I technically don't care what you call it, but I believe calling it post-treatment Lyme is going to make it harder in the long run because I'm going to get more. I think the official protocol, I'm very nervous, very scared that it's going to be immune suppressing therapies, and that will lead us down, making it actually harder in the long run to help people get better. I'm Dr. Warren. Hope you enjoyed this first video as we try to explain the difference between chronic Lyme and post-treatment Lyme.